Hi, this is Dr. David Snipelisky, one of the co-editors of the Fit on the Go blog. I'm here with Dr. Catherine Otto. Thank you so much for joining us. I wanted to ask you about the guidelines. How did you get involved personally in coming up with the guidelines and being on the authorship board?
I think people are selected to be on the guidelines committees based on their research and their interests. So it had been, I was on the previous version after giving many talks on aortic valve disease, and then with the revision of the guidelines, I became one of the co-chairs because of my involvement over many years in valve disease research and in previous guidelines.
Congratulations. So that means I've got quite a bit of work to do to get my research published, so hopefully I could be on some guidelines in the future. We know that the new guidelines came out recently. Could you go over some of the changes reflected in them and how you think that will change management?
Yeah, I think there are three really large changes. The first is the valve stages, the second is an integrative approach to risk assessment, and the third is what we call the heart valve team. I think the valve stages is the biggest important change because instead of just thinking about end-stage disease where intervention is needed, we want people to think about the entire spectrum from the patient at risk of valve disease, who we hope to eventually have medical therapies to prevent disease progression, the patient with progressive disease, and then end-stage disease. And these are the A, B, C, D stages that I think will really transform our thinking about valve disease. The integrative risk assessment is the idea that we don't just use a numerical score to say what a patient's risk is. We also look at factors like frailty, patient preferences, their likelihood of outcome, and try to integrate all of that into whether a surgical approach, a medical approach, or a transcatheter approach is best for that patient. I think both those changes are really going to change how we take care of these patients.
And what type of clinical implications do you foresee?
I think the clinical implication is really to use the guidelines as a guideline, which is what they're meant to be, but of course in the individual patient to take other factors into account and a more nuanced approach. Remember, guidelines are suggestions for how to treat patients, and they have to be interpreted in that context depending on what else is going on in your patient.
Well, thank you very much for talking with us today. Again, Dr. David Snipelisky with Dr. Otto here speaking about the new guidelines as well as participation within ACC.